Hi, good morning, everyone. So, Dr. Pravallika, are you here?
Yes, Sajid. Good morning, Dr. Ajit.
Hi, good morning, Dr. Pravallika. So, good morning, everyone. And I'm very happy to invite you all and, to our, the new course launch. I think it's been a long since we are working on the pharmacotherapeutics and pharmacology series and on different disease conditions, different problems. We are covering the things. So in 2020 September, we have started the biggest course from our side, that was the basics of pharmacology of cardiology, in cardiology, right? Then after that, we have started this master certificate course in diabetic pharmacotherapy in February, which is still going on in collaboration with Gitanjali Institute of Pharmacy and Gitanjali University, Udaipur. That also we got around 2,000 admissions. And these things are really, amazing when we, come up with something where, we can benefit more and more students, more and more pharmacy students, nursing students, or or medical students, where they can learn the real time, things from the doctors, from the specialists, from the experts of the field, right? So today, I'm very pleased to share this information that we are going to launch. Today we are going to launch the brochure, opening the course for registrations, and the course is very specialized. Specialized does not only mean that we are doing something in a specific disease, but it is very specific series for the a specific a population of students, or the working professionals. This time we are focusing clinical pharmacists. This time we are focusing clinical pharmacy students. This time we are focusing only pharmacy practice students. And of course, I mean, everyone can join. Whoever is willing, whoever wants to learn the oncology, they can join. But this is specifically the course modules, and the entire course has been prepared in keeping the clinical pharmacist in mind, because this area of oncology, I'm talking about the area of oncology. Let me share my screen with you, so I can show you the a little uh, brief about the course. Okay, so we are talking about the oncology clinical pharmacy series. This is a super special series focused on clinical pharmacists, and how they are doing, and how much they should learn, and how they can help out in oncology, how they can handle the drugs, how they can work on the therapy of oncology, how they can deal with the adverse effects, how they can deal with the chemotherapies. I mean, how they can deal with these oncological drugs and oncopharmaceutics with the patients as well. It includes the counselings and everything. So we are today we are going to launch the oncology clinical pharmacy series. As we all know, as we all know about the cancer. Cancer is a disease. We are all afraid of speaking in the public. The fear among the public, among the people, that cancers cannot be cured is slowly changing, as many cancer survivors are openly discussing and sharing their views, sharing their experiences. The complexity of the disease and the increasing incidence of the people diagnosed with cancer require a team of professionals and a workforce with specialized training in oncology. So it is needed to deliver the high quality cancer care to the patients, aligned with the patient's needs, values, and preferences. So to keep, after keeping this in mind, the pharmaceutical care concept has transformed the pharmacy profession, and we need more accountable pharmacists, who we need more knowledgeable pharmacists who can take care the cancer patients to achieve the positive outcomes from drug therapy. As we know, clinical pharmacists working in the healthcare teams need trainings in critical thinking, problem solving skills, and decision makings in providing the patient care. They should be able to apply new knowledge based on the cutting edge research in the pharmaceuticals to enhance the quality of life through improved healthcare in the community. So this course is, I'll not say much. We have very special person with us, the course director. After this, I'll call her to describe about the course, and then I'll open the forum for everyone to comment on, and then we'll talk about the course further. So, this course is actually designed to provide the knowledge, skills, and training for the pharmacists to practice as highly qualified independent professionals in delivering the patient care in oncology. So, I'll invite our course director, Dr. Pravallika. She is a PharmD, and she has done the residency in oncology, which is very, very specialized from JSS Mysore. And then she has worked in, as an oncology clinical pharmacist. So let me tell about her a little bit, then I'll hand over the mic to her. Dr. Pravallika is an oncology clinical pharmacist who has completed her PharmD from Alamein College of Pharmacy, Bangalore, and residency in oncology from JSS College of Pharmacy, Mysuru. She worked at Ramaiah College of Pharmacy as an oncopharmacist and played a crucial role in establishing clinical pharmacy activities in the Department of Medical Oncology. She trained national and international students during her residency. Dr. Pravallika also trained students from various colleges in clinical pharmacy oncology during her tenure in the hospital. She has taken the sessions on students virtually for the students virtually in antimicrobial stewardship and pharmacotherapy in oncology as well. So, in recognition of her academic performance, she was honored with the Wasabi Union Charitable Trust Gold Medal recently. Her areas of interest include clinical pharmacy activities in medical oncology, hematology, and BMT, bone marrow therapy. She has given guest lectures and seminars in various colleges. She has presented her research work at multiple conferences and won many awards. So, you're welcome, Dr. Pravallika. I welcome you to go ahead with the course curriculum, and please tell us what is this course and how we are going to take it. Over to you, Dr. Pravallika.
Thank you, Dr. Ajit. Uh, I don't know if many of you know me or you don't know me. Whatever it is, today I want to talk to you regarding this course. However, Ajit have introduced you about the course in brief. And you people know that once upon a time, the pharmacy profession was just restricted to dispensing the medicines or compounding the medicines. But it's transforming. The way the people think is changing. You need lot of people in the healthcare sector. Just doctors are not enough to meet the healthcare needs of the people. Now we need a healthcare team, just not the doctors to treat. You need someone to compound, you need someone to administer the drugs, and you need someone to prescribe you proper drugs. And slowly the clinical pharmacy have been started coming up and people started recognizing, and now specialty pharmacies have been started in India, which were not earlier there, and many of you started knowing it. When I joined, people even don't know what is a specialized clinical pharmacy. Specialized clinical pharmacy is nothing but the role of a pharmaceutical professional in a specialized area of pharmacy wherein which you deal them clinically, because doctors don't get so much of time to spend with each patient. And the physician patient ratio, when you compare, you have lot of patients and physicians are very less, and it's impossible to make you people sit the patients sit there and teach them everything about their disease. So wherein which our role comes, the role of the clinical pharmacist comes, wherein which a clinical pharmacist can help the physician in achieving better outcomes of the disease and play a very important role in leading quality of life or improving the quality of life of the patients. And now oncology you have seen, and how Ajit have told you, it's an emerging field wherein which we require people, we require so much of team to work with. And everything is new in oncology. Every day comes up new. Even yesterday you have seen a wonder drug which has come up in treating the colon cancer. So every day something new is coming, and people should get aware of the treatment. You should know the new treatments. But every time you can't depend on the Saridon for a paracetamol ingredient. You should know that Dolo is there, rosin is there, which is better, which is not better. But in foreign countries, what do they do? A generic is prescribed by the doctor. The molecule is prescribed by the doctor, but the brand is chosen by a pharmacist. But still, it's not come up in India. But still, you have an option to choose and tell the variable options to a patient on what all different things are available in the market. So, clinical pharmacist is not a small job role, and it has many, many roles. And in a specialized area of oncology, the clinical pharmacist plays a very important role. Okay, guys, let me brief you the contents. I think who are all here, around 50 or 60 of you are there, and I don't know if you all are from the clinical pharmacy background. Please remove something in mind that I'm first year, I'm second year, I'm third year, I'm fourth year, and I'm fifth year, and I'm in intern. And don't even think that because I'm first year, I don't understand oncology. Because I'm second year, I'm still studying my pharmacology. And third year, I just started with my therapeutics and just my pharmacology got over. Still, I have to complete my pharmacology. And my fourth year, I've just done. And fifth year, I have research. And sixth year, I'm in internship. I don't remember any concept. So, in one or the other way, everybody is sailing in the same boat. So, you need not worry in which year of your study you are. Knowledge is not restricted to someone. You can earn, and certificates can be given to anyone. And don't think about the certificate. Oh, what will I do with this? So, learning, educating yourself, gaining knowledge is not restricted to anyone. The same way, whichever you are, from first year to sixth year, whether you're a nursing professional, you're a doctor, you're a pharmacist, you're an industry person, you're from the pharmaceutical company, you're from the home, whatever it is, wherever you are, nobody is restricting you from learning. So, and to learn, you should understand, right? If you should understand a concept which you don't know at all, still you think that I don't have basics. How will I join the course? How will I understand? How will I know? Does it worth me? Will I be able to understand? I'm not able to understand guidelines of hypertension and biohacking. What will I understand cancer? I have my PT2 exam. That is a very difficult topic. Oh, let me leave it for choice. I know, even myself, it was difficult for me when I was studying pharm. It was so difficult. I don't even know how to pronounce the names of the drugs, but I have not seen a single while during my founding. And when I joined, imagine I am also in LKG state. Like I'm going to a KG class in oncology. A, B, C, D. I don't know anything in oncology. But when you learn ABCD, when you know ABCD, when you know to frame a word, you can frame a sentence. When you can frame a sentence, you can write multiple sentences and make a paragraph, and you can write stories about it. To learn ABCD, you can learn it even if you are an old woman. You can learn it when you are just 2 years kid, when you know to speak. And you can start off when you are a KG kid or when you join a school. So there is no age restriction to learn alphabets. Even night schools are there. There are many people who are uneducated are still learning even after 10th standard, after their wedding and all. So there is no restriction. It's all facts. And I'll tell you, I'll not bore you with the contents. I'll tell you how. End of the session, I'll ask you one single question, and I want an answer for that. Okay. And before I start off, I'll share my screen, and please try to understand what I'm explaining, and don't think why did she start with this presentation like this. You'll get an answer at the end of the presentation. Okay. Ajit, I'm sharing my screen. Please check it out.
Yes, please go ahead. It is not, yeah, it is coming now. Let's make it full screen. Okay.
Can you see?
Yes, now it is full screen. Please go ahead.
I like to start with this quote. You must be the change you wish to see in the world. See, many of you, after studying formally, many of you will be thinking about what's next. You have so many multiple options for your career: medical writing, CDM, teaching, so many things. And an actual pharmacy is like a clinical pharmacist who really wants to be. And now, why did I tell you this code? There's a reason, like many people like texting me. Many students have texted me regarding oncology, ma'am, which college? We don't have this information. We don't have that information. We don't know this. So I thought now very few colleges, like very few hospitals, like JSS have 2 seats, HCG have some few seats, like 2 or 4 something, and Shankar have to. Very few places have. See, out in India, there are so many aspiring clinical pharmacists who want to become specialized clinical pharmacists, but the opportunities are very less, wherein which they can learn and gain knowledge. Even if you develop interest, I've seen people messaging from 4th year, 5th year, 6th year, 3rd year, ma'am, is it there? So when it will be coming? What is that? What is this? So it gave me a thought, why don't I teach them virtually, irrespective of whether they can learn it from the college or they can learn it from home, and it can be learned by multiple students, n number of students. Why don't I train them virtually? Just with that thought process of spreading this clinical pharmacy oncology knowledge, which I have gained through my experience and learning in a simple way, is my complete thought of making this brochure or making this course come into force. So I'll tell you, don't get scared because it's oncology. We don't even know names. I'll tell you how simple oncology is. Oncology is not so difficult when you have someone to drive you through that. You can drive through, even you can do skydiving, you can do paragliding when you have someone behind you. Think that oncology is similar way. And at the end of the session, I'll ask you one single question that you have to answer. And see, you have so many contents. What will be the contents? And I want to tell you, this oncology clinical pharmacy series will be in the form of multiple modules, because you cannot teach them in a single module. Please switch
Pravallika,
off
the
your
screen
mic.
is not changing.
No, no, screen is not changing. Yes, I have not changed it. I think somebody's mics are on. Please mute your mics. Okay. Yeah. Sorry. Okay, I'll explain you all the contents. This series in the form of modules. Each module includes a theory part, a practical part. Initially, you will have first 2 modules which will deliver you the basics on understand what are all the concepts that you require to understand oncology or oncology clinical pharmacy or the disease of cancer and the drugs and treatments. If you should understand something, you should have the proper basic background, and you should have a good foundation. A good foundation is always important to construct a very big building. So in the same way, you need a very good concepts in oncology, a minimum basic concepts that will make you understand all the cancers in a very easy way. So for that, we have designed them in modules form, wherein which each module contains a theory and practical approach, and you will have a worksheets wherein which you can work on it to get thorough with the modules. And you will have sessions in between after every 10 hours, wherein which if you have missed the classes, you can sit and discuss. And all the students will be divided into group, the enrolled students, and you will be dealt with some guide or a mentor. A mentor will be there who will be leading you, wherein which you can post questions, and I will be there in every group, wherein which will be guiding you with the worksheets and your doubts. And you can mail, you can text, or do anything to clear your doubts and learn. And at end of the every module, you will be having an examination, wherein which you can test yourself how much you are thorough with the module. And after the examination, you will be given certification. There is no nothing like that you will be given certificates without writing exam. It's very clear. And internship guidance can be given to the people who are in Form D internship and post Form D, because you are not allowed to touch oncology drugs in the hospital if you are till 5th year. So for 6th year students, you have that opportunity, but till 4th year and 5th year, you have an opportunity of learning it virtually with real time cases. and we will be explaining you how the things will be going on in the hospital. That is the only difference between enrolling of first 5 years and sixth year and post pharmacy students. And even B Farm can learn because it helps you in gaining knowledge, because many industry people are searching for pharmacists who are having oncology knowledge. And since our modules are related to clinical pharmacy, most of it is oriented to the drugs. A disease will be explained and complete drug focus will be there, how to deal with each drug of chemotherapeutic drugs, immunotherapeutic drugs, targeted therapeutic drugs, how to administer the drugs, because administration is the important part of the nursing. So even the nursing people also can attend this course and learn how to administer the drugs, which will help them for a better patient care in the hospital, wherein which they don't have a clinical pharmacist. Okay. See, it's a need of the hour. And another thing, why is there a question mark behind? You all are students. You need to question me. Ma'am, why do we need to join this course? How does it going to help? How is it different from other things? We are attending so many courses. They teach, somebody come teach and go. And sometimes we are bored. We sit on mics, we sit there, we don't teach anything, we don't listen, we need a certificate, so we do attend. It's not like this. People need to question. How you know the basic characteristic of human being? The minimum thing is a cell, right? For the living organism, the basic is cell. In the same way, the basic thing for every student is to question, and it's your right to question. When you question, you learn. And please do ask me questions in the end of the session. Okay. You can see here something. Okay, I have mentioned something called as introduction in the module. The module one, the first topic will be introduction. Why I'm starting you with Tare Zameen Par. And you have seen a baby. Baby is normal, but his thought process was, you can see when he was counting, when he was seeing alphabets in the sky. But nobody could understand him, right? Why this is happening? That's not his mistake. But he's a talented person. But he has a good guide who has identified this, and he has corrected. When his father has scolded, he is crying because he's clueless. The similar way, the cancer cells are also similar. They don't know what's happening to them, who is disrupting them. The pesticides, the UV light exposure, and because of the food, whatever it is, they don't know. But when you diagnose properly, when you control them properly, when you eat good food properly, they don't skip their limits, they don't cross their limits. If this baby was cared and handled properly, you can only see the smile in his face. Why? Because nobody is scolding him. When his father scolds, even without knowing what happens, the baby cries. In the similar way, cancer cell also reacts when you don't respond in time properly. When the growth controls, as you grow, you should have some control. There should be some homeostasis. Your immune system will take care of it. How much time it will take care? Okay, okay, okay. Exhausted, will react. Then a normal cell loses control where you cannot control and changes everything. Then comes cancer. If you control, there will be no cancer. You can understand how the introduction goes. And cancer disease scenario according to different systems of medicine. When you get cold, cough, fever, everything, the first thing you see is home remedies. I want to see home remedy. Mom says, hey, don't go for simple antibiotics, man. It's very difficult to handle them later, because they are also know something. If you take antibiotics continuously, it's not going to work. Mom says, you drink this kashayam, you drink this ginger juice, your cold will be okay, your throat will be okay. Even during corona times, many of us prefer home remedies in prior going to hospital, thinking that where if I get positive, I have to get treated. And some will tell homeopathy is good for me. Some will tell Unani is good for me. But in the same way, see, for decreasing your obesity, you have keto diet, fruit diet, vegetable diet. You will be thinking, right, which to choose. And you have pills also. You will be thinking which to choose, which is best for me. In the same way, even for cancer, many people tell Ayurveda cures, allopathy cures, Unani cures, Siddhi cures. So at least you should have a basic idea why they're talking like this. Can you do combination of Siddha and allopathy? Can you do combination of Ayurvedic and allopathy? You should give a thought process. So you just can't go directly into the course telling that I want to learn this drug, but learn what are the options available. You cannot leave of Ayurvedic doctors. You cannot leave Unani doctors. You cannot leave homeopathy doctors. Everybody have a role to play in a different way in treating a disease. So you should know what are all the options available. Then think of, based on your condition, based on your situation, based on the stage of cancer, which to choose. Okay? How simple it is. You're understanding something, I feel. And general concept of cells and cancer biology. I think here it's the season of pickles and tomato. You see in every curry, every whatever you do sambar, you do dal, you do anything, you do leafy vegetable, everywhere you find tomato. But I just want you to see these pictures. You can see a green color tomato. It's become yellow in color, dark yellow. Then slowly turn to orangish red. Next, ready to eat. Next is a cherry tomato. It's become completely cherry color red. So it's ready. And you can see down, there are some tomatoes which are exposed to pesticides. To spray pesticide to a plant, you are seeing someone covered with a PP. And you see how the tomato looks when you spray pesticide and how it is when it is on the tree. And when you observe, when you do test, you can see so much of bacteria. And last, you can see something have right. Okay. When normal cell grows, it has different stages before it becomes rotten or before it gets ready. In the similar way, a cell undergoes so much of stress, stress in the form of ultraviolet rays, smoking, alcohol, DNA damage, multiple factors, fast foods, all these things. When the pressure increases, what will happen? The quality decreases. When the quality decreases, the time to damage is very less. When a fresh tomato should damage, it will take time, which is organic. You can even preserve it. But in case of a tomato which has undergone so much of pressure, you have to clean it with the vegetable solutions. You have to do water it. You have to put it in salt water. What not you have to do for vegetables before you cook. You have to do so much of processing, right? If not, it gets damaged. You cannot mix a pesticided vegetable with other vegetables. It also damages the other vegetables. In the similar way, when the pressure increases for cells in different ways, it will lead to multiple organ damage. And the changes in the cell occurs very fast. With all the cellular changes will lead to cancer. Okay, it's not so difficult. You can remember this concept, and this is how the cancer biology goes. And treatment modalities of cancer. You can see tomato here just shrunken. Here there is some damage, and you will see multiple spots on a tomato. And the next one you could see some damage in the tomato, and at last you can see it's almost damaged. You cannot use it either way. Okay, what are these treatment modalities of cancer? It's nothing but the different treatments available. It's like, see, when a tomato is like this, you cut open and use it for your rasam or dal. When tomato is like this, just chop off the top part and you check it. When there is multiple places, you try to chop it. And if you cannot, what you will do, you'll take it, put it in the sun, dry it, and put it. If you get good seeds, you will put it for new plantation. And little more, then you will think, okay, let me chop off and give it to some dogs or some animals like that. But when it is completely rotten, you don't give it to anybody, that you will throw it out. In the same way, when the cancer develops in the body, when it is in initial stages, when you diagnose, how do you treat? What is the treatment option? The surgery, radiation, or chemotherapy, or a combination of surgery and radiation, surgery and chemotherapy. It's similarly like how you preserve a tomato or how you use a tomato. Okay. And I'll tell you the clinical strategies for cancer treatment. What are these clinical strategies? You just cannot tell, okay, I'll go for surgery, I'll go for chemotherapy, I'll go for radiation. Option is not in your hands. Option is depending on how, it's like a tomato, how much the cell is in damage. What areas are in damage? Are there multiple lesions? If I water it, means symptomatic treatment. The tumor is not growing very fast. If I water it for time being, it's okay. Tomorrow I can cook. I'll water it and see to that it is not exposing too much to sun. So it will be fine. I can use it for tomorrow. With a temporary cure. You want it permanent cure. So at what stage I am? Should I make it into a pickle and store? I should make it into a tomato puri and store? In the similar way, should I take up surgery done, remove it, and then use it? Means you can chop off the tomato and you can use it for vegetable that day. Means you have to perform surgery instantly to prevent the spread of the cancers. There's some cancers which will go very slowly. Then at that time, what you have to do? Sometimes you can make sauce and prepare in the same way. What you can do is you can go for surgery and then you can go for the further treatments of chemotherapy to prevent it. So what are the clinical strategies? Should I so appropriate to make a puri? You have some ingredients, so you have to choose it properly, right? In the same way, the treatment and dosing, all this comes in clinical strategies. You can't give 200 mg dose of a cancer drug to every patient. I'm very thin. I have kidney failure. I have liver failure, says one patient. The next one comes. I just have kidney failure. My liver is good. And both of them require same treatment. How to give them? What are the modifications? So what are the clinical strategies? What are all the things that you have to consider in treating a cancer treatment? That comes in the clinical strategies for cancer treatment. And you can see principles of pharmacokinetics. Why are you talking about principles of pharmacokinetics? Even if you know you can make a pickle and store it, but if you don't have proper ingredients of storage contents, proper salt, proper chili, proper ingredients and proper nutrition, there will be some damage by microbial contents. That's why here you can see two brands of sauce. To prepare it, what you will go and see, you will go and see what is the expiry date, what are the ingredients, what are the excipients, how many days you can store it, is it okay? So the similar way, what is the patient condition, what is the dose required by the patient, what is the patient cancer, at what stage he is, can he tolerate this dose, what are the possible side effects if I give, will it reach the toxic levels in the blood, or will it go underdosing, will it go overdosing, is it properly calculated, properly administered? To administer, what are the drug characteristics that I have to consider to give it to a patient? It's not just the body surface area I calculate and give a drug to a patient. There are multiple things. G6PD deficiency is there. So what should I do? There is some genetic abnormality. There is something. There is some digestive issues. There is some absorption issues. The drug gets absorbed in the stomach. Patient is a known case of cancer. So how do I deal with the dosing? So this all comes in principles of pharmacokinetics. And when see common toxicity of cancer drugs, I told you guys, right? I can't remember so many drugs, ma'am. It's very new to me. It's very toxic to remember. I don't even know how to pronounce the names of cancer drugs. A few examples how you can learn. You can see something C in place of kidneys. C is nothing but cisplatin, carboplatin, all these drugs. They're very nephrotoxic. In addition to other effects, these are the prominent effects. When you see V, it's vincristine. Vincristine will cause peripheral neuropathies. So these on the periphery. So you can draw a picture. You can remember it like this. This is how the common toxicities can be learned. And another thing, chemotherapy does not mean that you're treating cancer. Chemotherapy will act on the cells which are very active, which are dividing continuously. Okay, which are dividing continuously. What does it mean? See, you get a wound, a cut on your hand. You have some function. You feel so bad that I can't wear mehendi because of this issue. But after 1 week, you have another function. It gets healed, right? Why it gets healed? Because the old cells, after going apoptosis and necrosis, new cells start producing. The cells are in continuous cell division. That's why you're getting back. But when you can see in case of liver, when a heart is damaged, it's permanently damaged. You only can preserve the function, but you cannot get new heart. You cannot get a new brain. Once nerve cells are damaged, once you get stroke, and if it's not treated in the golden hour, it's damaged is damaged. There is chance of paralysis. Very, 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 very point not 1% of getting it back. Because we cannot say something is not impossible. In the similar way, okay, the toxicities comes because they act because your GI cells, your skin cells, your nail cells. Whenever you ask what is the side effect of anti-cancer therapy, you start speaking it's a hair fall, madam. diarrhea, vomiting. Why? Because all this GI part, all this hair, skin, they're continuously dividing cells. Chemotherapy not only acts on cancer cells, but still it acts on the continuously dividing cells. That's why you see adverse effects. Which, see, this is how you learn. This is how you learn the module. Why? Everywhere, why? There's a question mark. Why are we getting this side effect? How to treat? What you should do? This is how you will be taught for common toxicities of anti-cancer agents. Dosing of chemotherapeutic agents. I told you, dosing is very important part of administering chemotherapy. As the same as the season of mango pickles, you need correct ingredients to make the tasty pickle and preserve it, even to send it to foreign countries to your cousin center. When something is not proper, the taste is not proper, the whole pickle gets spoiled. For 1 year you are not going to have your mango pickle at home. The dosing of chemotherapeutic agents is also similar way. When you don't see the liver function, renal function, when you don't see the blood counts, if you don't see the blood count, you know that bone marrow cells are also continuously producing, and the toxicities will be there, because of which you will see lower blood counts. Lower blood counts will lead to infections. So you can remember why dosing of chemotherapeutic agents is not just a Mosteller's equation. Okay, this is how it goes. And roles and responsibilities of a clinical pharmacist, oncology clinical pharmacist. I'll tell you what is your role in preserving it. A tomato should not get spoiled. You should put in a proper refrigerator, or should be separated and put depending on the quality of the tomato, or should water it. You have different options. It's your role and responsibility, because you have grown your tomatoes in your garden. You need to preserve them, and you need to eat them when they're very healthy tomatoes, not when they're ripened or something. So that you take care, right? You plug them, you put it in the refrigerator, you separate them so that it won't get affected by the other vegetables which are already spoiled. So you take care of it. So what you will do as a role, as a clinical pharmacist, what you will do, you have different roles. You see drug interaction. Similarly, how two vegetables cannot be mixed together. You'll see which two drugs cannot be mixed together. And patient counseling. Why you are counseling a patient? Why you are telling? Why your mom tells you, please put it separately. So that it's prevention is better than cure, right? In the similar way, somebody is educating you that this will be there, you should have to take care, so you need not worry. So something is preventing you from harming, and somebody is there to check that you are receiving a proper drug on time, because everybody is not educated. You need to educate your patient. In case if the patient develops adverse effects, what to do, patient counseling during the cycle, how to reverse your side effects, how to talk to your doctor, how to help the patient, how to help the patient's family. Everybody is not affordable. Everybody cannot buy tomatoes in all the seasons. The price will go 100 rupees, 70 rupees. You should tell them about the clinical trials available. And you should tell them what are the free treatments. You should know about the government schemes. How do you educate a patient? So many things comes up as roles and responsibilities of a clinical pharmacist, which you can compare with that. And you can see when you have different problems, when you have different cancers, when you have different patients, how to deal with it, how to go about in the hospital. A ward contains a mixture of patients of bone marrow transplant, a hematology unit, a BMT unit, a medical oncology unit, and you have in some hospital wherein which you have daycare beds. How to deal with the patients, which to deal first, which not to deal. When you have 10 patients and you are only one clinical pharmacist, whom to deal first, whom to prioritize, how to prioritize, which drug is in alert stage, oral chemotherapy, how to give oral chemotherapy, how do you guide them after food, before food, same timing, what to take with what not to take. For taking oxaliplatin, you should not have cold nephropathy, you should not put your hands in cold water. And you're a diabetic patient, you can't go and tell every patient, please take fruits. Fruits are having good lot of antioxidants. You will have health benefits. You cannot tell that to a diabetic patient. And you have a drug carboplatin mixed with dextrose. There are some drugs which are compatibilities with normal saline and dextrose. You cannot. You should know which patient you are giving. Preferably NS is there. You have to dilute it with NS. You have to tell patients their paclitaxel, which will cause hypersensitivity reactions. You should know whether you have to mix it in PVC or non-DHP bags. So giving the drug for the first time, which is having so much of hypersensitivity, at what rate of administration you should give? what you should go and talk to patient. All these comes in roles and responsibilities of a clinical pharmacist, and many more to tell you, and that will be taught in the further classes. And pharmacovigilance in oncology. And when you're choosing some food, why do you go for a branded ones? Why do you choose a brand? Why do you check ingredients? Why do you check that labels? ISA marking, that marking, this marking. Why do you check? Why do you check the food labels? To see the standards, right? You just can't go and you don't go and take because somebody is giving you for 100 rupees. You don't go and take an expired one, right? Why? Why you're seeing standards so that you feel good. Okay, these have undergone some tests that these are not harming you. And what do you do after eating food? You go and complain. I had diarrhea after eating food. Similarly, the same way, pharmacovigilance. You should know when different batches are produced in different industries, different batches produce different reactions. And see, a patient who is taking cisplatin have vomiting. There are patient A, patient B, patient C, patient D. All of them have vomiting. One has 2 times per day, one have 2 days after chemotherapy, one have immediate vomitings, one have just before giving the drug. And you could see so many patients having nausea in different stages, vomiting in different stages, the episodes of vomiting, everything. So you should treat a patient based on his condition. For every vomiting, you can't go and give some drug. And for everything, for every constipation, you can't give Duflac. For everything, for every patient is not same. Every patient is individual by himself or herself. You have to treat accordingly. So you have something called gradings, the toxicity criteria. A cisplatin, a similar drug in a similar one type of head and neck cancer patient. How did it produce nausea? What's the causal relationship of nausea with cisplatin in a patient with head and neck cancers? What is any other factors are contributing? What is the causal relationship of vomiting with paclitaxel in a lung cancer patient? What is the causal relationship? So every nausea is not same. You just can't report it's a nausea. There is a differentiation. The drug, chemotherapeutic drugs are used for multiple cancers, and you should know which causes which reaction in which cancer patient, in how depth it is, in what grade it is, and how do you categorize and report. A proper reporting system of toxicities of anti-cancer drugs that you will be learning in pharmacovigilance in oncology. And I would only tell one thing, that being a pharmacist in oncology, everybody's is a crucial role. Without a social worker, without a pharmacist, without a nursing, without a doctor, without a PG student, or whoever it is, the healthcare team, everybody's role is very important. And it will only be successful only when healthcare team delivers a treatment. How good ever doctor you may be, you will prescribe it nicely, but when you don't have a clinical pharmacist to prepare your drug, the dose changes. It can harm your patient. Doctor does not know why it is not being delivered. There's nursing people. You have prepared properly, doctor have prescribed properly. They don't know to administer. What's next? You don't have somebody to educate you about the trials. You even lose hope. You need a social worker there to help you with. You need multiple people in the healthcare team for a successful delivery of chemotherapeutic drugs. And I feel that hope you people understood my presentation and how the modules will be dealt continuously. There will be around 10 to 12 modules wherein which you will learn oncology with first 2 modules of basic, and from third module we'll be learning about the cancers in specific and how to deal with each type of cancer, what is the role of a pharmacist.
Let me share, Pravallika, let me share the this what we
Yeah,
say, or then you talk about
yeah,
it.
one last slide.
Yeah, no, that our schedules of this. One sec. Um, where is this? Yeah. So here is the content for module 1. Yes, Pravallika, please go ahead with this. Yeah.
See, you can see general introduction to cancer, cancer disease scenario according to different systems of medicine, general concept of cells in cancer biology, hallmarks of cancer, treatment modalities of cancer, clinical strategies for cancer treatment, principles of pharmacokinetics, drug delivery, uh, scientific principles of cytotoxic chemotherapy, classification of anti-cancer drugs, pharmacology of chemotherapeutic agents, common toxicities of anti-cancer agents, dosing of chemotherapeutic agents, roles and responsibilities of oncology clinical pharmacists, patient counseling and consenting chemotherapy, pharmacovigilance in oncology will be a first module. And the question which I told you people I want to ask you at the end of the session is any questions first thing?
So yes, guys. So anyone can attend this course. Of course, we have a very vast, syllabus covering for the module one. As Dr. Pravallika told, this entire course, the entire course on oncology will be completed in 1 year. Okay. So this is the first module. So it is like interest based. The person who wants to continue and who wants to complete all the modules, can get one specific specific PG certificate at the end of this course. I mean, at the end after 1 year. But you can, attend all the modules separately if you want as well. Okay, so this is the module one we are, launching now.
And
So
another thing is you will get certificate for every module.
of course, I mean, every module
Yes.
you are getting the certificate, but if you are enrolling yourself for all the modules, you will get one, PG certificate also, for the oncology clinical pharmacy series, entire series at the
And
end.
another
Yeah,
thing is before the first module completes, prior to 15 days, you will get the second module.
yeah, second module, links and all will be set.
Contents, yes.
Yeah, and we are starting this course on, 16th July, and this first module is around 3 months, 20 plus hours. I mean, 20 plus hours. So, we'll be taking around 24 hours for this module. And the registration fees is 3,000, but in that we are, going to give a lot. This is the registration link, and you can just check it out. You can just check it out. And, along with that, guys, one more thing I must say, we are, trying, we are trying our, best to provide the best, education in different domains. And for this course, especially for this course, I am trying to get the live internship in the hospitals in Hyderabad and Bangalore, and in, other hospitals as well. For you, whoever is joining in different states, they can, join our collaborative hospitals for the internship as well, along with this course. If you are interested in this course, definitely you will get that chance as well. Okay.
And that internship in hospitals will be only for 6th year PharmD and post PharmD students.
Yes, of course, not for the first year and second year. That would
No.
be for the fifth
Yeah,
year.
you people get only virtual internships or virtual things that you can learn of because you're not permitted to work in an oncology care hospital without the knowledge. So this can help you during your internship process and revise you'll be a perfect clinical pharmacist at the end of PharmD, even before you go for a specialization.
Yeah, so this is like, this is the first module where you can start, boosting your knowledge, and from the second modules, definitely, you will be getting a chance to.
And third year, fourth year, fifth year students, after you finish your pharmacology, or even to first year students, I will give you the opportunities based on your interest and learning, and I'll give you an opportunity to make the documents, drug document preparations for oncology chemotherapeutic drugs. We start off with a different stage of. It's not that first years are not given importance or second years are not given importance. Everybody of you are treated equally, and based on the level of your knowledge, you will have a worksheets or something like that.
Yeah, there are many
Because
things.
internships are for final years only.
There are many interesting things for you can see here. This, as we can see here, we have experts, we have leaderships and mentorships for that. And you have, many worksheets and group assignments every time and after every class. And, all the practical learnings will be included in this. You will be learning from the, experts in this course. So this course material will be shared with everyone very soon. very soon, means today itself, it will be available in all the social medias, all the groups, all the WhatsApp groups, messages of CLIMAT, wherever you are associated with CLIMAT. We will be sharing this everywhere. And now I would open this forum for the discussion, and I would invite Dr. Pravallika, you want to invite someone?
I don't know who is on, and anybody can ask me questions, whoever is here.
Yeah, anyone who has the questions first,
Any
they can
doubts,
take the
anything I
questions, and then
can clear.
I'll invite. I can see Dr. Kanavkera is here, Dr. Ramnath sir is here, and I can see Dr. Karthikeyan is here from SRM. So he's the head of pharmacy practice, and Professor Dr. Kanavkera is here from lovely university, lovely professional university. Many people are here, and anyone first who have the questions can clarify. If no questions, then I'll go to Dr. Kanavkera. Hello, sir. One sec. Yes, okay. Somebody is raising the hand. Please ask the question.
Yes, sir. Good afternoon,
Yes.
sir.
Good afternoon.
My question is that how to suppress cancer at first time, and what is the choice of drug of cancer?
Hello.
Yes, Dr.
Yes,
Pravallika.
Can you
yes, ma'am.
clarify me the question? I cannot hear you.
Ma'am, how to suppress cancer patient, and what is the first choice of drug?
See, the choice of drugs depending upon the proper diagnosis. Whether it is stage 1, stage 2, stage 3, what type of cancer, and what is
Yes.
the performance status of the patient. See, the choice of drug is according to the guidelines, and that will be decided by the physician based on type of cancer. That will be only dealt after proper diagnosis and workup. For each cancer, based on symptoms, there will be sequential diagnosis for every cancer. There is a procedure, there is a protocol for every cancer, how to deal with it based on your symptoms. See, GI cancers don't get diagnosed just like with a stomach pain, you go with a loose motion, you won't get diagnosed. Many of the cancers are diagnosed by chance. You go for something and you get diagnosed with that. And when you get diagnosed, first you'll go for an X-ray. X-ray does not give you proper information. Then you'll go for CT, next MRI, and at last PET scan. So step by step, whatever the reports are revealing based on that test, and the physician, there will be a team. It's not one single person decides your treatment. There is something called as tumor board, wherein which you will find a surgical oncologist, you will have radiation oncologist, you will have medical oncologist, wherein which people sit and discuss a case together even before deciding a treatment. And based on availability options, based on the schemes that is government is facilitating, there are some drugs that will cure your cancer, but everybody cannot afford it. So which line of treatment to choose? What is the outcome? What is the overall survival rate after treating you with that drug? And what is the patient status, patient condition, financial condition? Everything they will show. There are many government schemes which are providing you free treatments of cancer. So when that can be cured, you will be there. There are some patients, they'll enroll them in clinical trials where they cannot afford the treatments. Even the poorer people get a chance to best treatments and expensive treatments when you enroll them in clinical trials. So the treatment is decided in that way for every cancer. Got it?
Okay, ma'am. Thank you. Thank you, ma'am.
Any other questions? Anybody? If you don't have questions, shall I ask you a single question after my presentation?
Please go ahead.
Yes. Do you feel that oncology is not so difficult that how you felt when you're studying therapeutics? Do you feel it interesting? At least did you understand something from my slides?
Of course, guys, please give the feedbacks. And I think Dr. Karthikeyan is here. Karthikeyan, sir.
Yes, sir.
Yes, sir. I would definitely would like to take your comments.
Wait a minute.
Hi, Karthikeyan, sir.
Yes, sir. Yes, sir. I've been
Yes,
off the
I
time.
would like to take your comments on the course and how it is, going to
Yeah,
be.
it's a very, very important course. Actually, the session was very interesting today. There's a need of that thing. Been concentrating on various clinical cases, and regarding oncology, it's very good. Mainly for pharmacy students, this oncology subject is very much essential. So, based on that, this course is considered to be a very important one for all the faculties as well as to the students. So,
Thank you,
so
sir.
this is
Thank you. So we are definitely, we will try, more to include in this and, make it very, very, easy and make it very, what we say, practical learnings, to all the
yes,
students and all the participants, definitely.
yes.
Thank you very much.
Thank you, Ajit. Sir. Thank you.
So if no other questions, we can conclude, Dr. Pravallika.
Okay. Hope I made the presentation easy for you people to understand oncology. Think that it is not a rocket science.
Of course. Registration links we will share in all the groups and, in our social media. So
Okay, guys. All the best, everyone.
yes, thank you very much. And let's see, and you will get, as you are getting from us, the best only. So don't worry about that. I guarantee for that you are not, going to get anything lesser, whatever is, promised. So, okay. Thank you, guys. Thank you very much for your interest. And thank you very much for attending this on the Sunday mornings and almost 1 hour we have spent. And, so take care and have a good day. Have a good Sunday. Thank you very much, everyone. Thank you. Take care.